Hello everyone, I am Dr. Vijita. I am the Chief Operating Officer at MediGence. I handle the medical operations. Today I have the privilege of interacting with Dr. Ashish, who is the Unit Head of Liver Diseases at Fortis Hospital. So sir, hello. And sir, I want you to give an insight about your specialty.
Okay. So hello everybody, I am Dr. Ashish George. I am the Unit Head Department of Liver Transplant and HPP Surgery at Fortis Hospital, Shalimar Bagh. So the majority of patients that we deal with are patients who have liver diseases, pancreatic biliary diseases, cancers of these organs, and other non-cancerous benign conditions also. The major surgeries that we do are again related to the same organ systems, and liver transplant is a surgery that we do quite often.
Okay. So sir, what are the types of liver diseases that are more common?
So see, most patients that suffer with liver diseases would have an acute condition, meaning they'll have hepatitis, which is usually a self-limiting disease. So like something like a hepatitis A, hepatitis E, a few other viruses also affect the liver, which affect the liver, cause some liver dysfunction, but the body is able to treat it on its own. And then it will go away. Mostly the treatment for these patients is supportive. You just have to ensure that no other untoward incidences occur while the patient is recovering. There's no particular treatment for these diseases, as it is the body's own immune system which manages this. So these are run-of-the-mill, jaundice, the standard jaundice that patients suffer from. And then the other set of diseases are the chronic conditions. You would have heard a lot nowadays of fatty livers. In India, it has an increasing incidence now. Similarly, patients who suffer from chronic viruses like hepatitis B, hepatitis C, which in the long term can lead to failing liver, which is called a chronic liver disease. Then other, cancers of the bile duct, cancers of the liver, pancreatic cancers. Those are the kind of patients that we deal with.
So sir, we get a lot of queries regarding liver transplant, which happens mainly during the end-stage liver disease. So what is the stage wherein we recommend a patient to undergo transplant?
Okay. So see, a liver transplant is a treatment that is given for a failing liver. Now, the liver can fail either acutely, like let us suppose, for example, some patients suffer from some hepatitis or a drug-induced injury or anything which causes an acute event. Liver was normal before, now it has got injured to an extent where the life is threatened. So that becomes an emergency where you offer transplant. This is less common. What is more common is the chronic liver diseases, like because of long-term fatty livers, because of alcohol, hepatitis B, hepatitis C. These continue to injure the liver. Injury happens, liver recovers. Injury happens, liver recovers. Because the inciting agent is continuously acting on the liver, over time what happens, which may be years together, where the regenerating capacity that we of the liver is overwhelmed, and the liver is not able to regenerate properly, adequately, and then what happens is that the liver functions start to decrease, because initially the liver was able to recover, the function was maintained, but now because the inciting agent is ever present, it has affected the regenerating capacity of the liver. The functional liver volume has decreased, so liver is not able to work at the same pace as it used to previously, and then slowly the symptoms will start to come. So you've got acute liver diseases, which is a separate set. Then you've got diseases where the liver will progress. Fatty liver, then inflammation is there, NASH as it is called. Then there is fibrosis, and then there is chronic liver disease. Now till fibrosis, if you remove the inciting agent, there is a fair chance that the liver disease would recover.
Basically, a stage comes where the liver disease is irreversible.
Yes, that is when cirrhosis happens. That is when you know that the liver is not going to recover to its normal state. it might, if you remove the agent, it might stop there, or it might progress slowly, or occasionally it might continue to progress in the same speed.
So sir, in brief, can you just tell our viewers more about the transplant process, both for the patient as well as the donor? Who can the potential patient, you have told us,
Yes,
the person who will undergo this transplant, but who will be the potential donor for the patient, and what is the complete process involved?
sure. So see, liver transplant are of two types. One is a cadaveric liver transplant. Then there is a live related liver transplant. Now cadaveric is where you have a brain dead donor. Patients on a ventilator, the family is kind enough to say that yes, we want to donate our patient's organs, and then they go to whoever is on the waiting list for various organ systems. Now in India, for some reason, even though it is coming up, still the organ donation rates are extremely low. So what is more common is a live related liver transplant, where somebody from the family comes forward and says that yes, I want to save my patient's, my relative's life, so I would be willing to undergo the process of evaluation, surgery and the recovery. Now question is, who is it who can donate? So first is obviously it has to be from the family. So the laws divide family into two types. One is near relative and other than near relative. But all in all, just to be not confuse people, anybody who is related by family can donate to their patients. Then the second thing is they have to be between 18 to 55 years of age. The donor. It has to be healthy. Obviously as you age, the recovery capacity of the body, the ability to take stress decreases.